Want to learn easy and highly effective scalp protocols? Well, you'll probably want to stick around because in this episode, I'm going to go over some details of the very best practices for performing electroacupuncture on the scalp, how to treat scalp points from the ear, and how acupuncturists can use these protocols to improve patient outcomes. My name's Dr. Jeremy Steiner, and I help acupuncturists like you create breakthrough patient results with the world's most cutting-edge electroacupuncture techniques. Now, if you're not already subscribed, go ahead and click the subscribe button now. This way you can receive a notification each time I release a new training episode. And along with each video and blog, I give away a free downloadable training resource. And for this episode, it's called Easy Scalp Electro-Acupuncture Cheat Sheet. So don't forget to download this. Also, click the link near this video in case you wish to find out more details about my high-end program called the Electroacupuncture Medicine Experience Mastermind. Let's dive in. So brain injuries, if you could get them into ketosis, that's very helpful to prevent further damage. They need to eat plenty of healthy fats, avoid plastic like trans fats. This makes sense. More than 50% of the nervous system is made from these healthy fats. How can you expect the body to regenerate if it doesn't have these healthy fats? And if it has these plasticky fats, it's going to regenerate the cells with sort of a plasticky type of membrane. And this is what I said here, 50% of the nervous system by weight's made up from cholesterol. Statins, Lipitor, Crestor are very common prescription drug, prevent cholesterol production by the liver, but cholesterol is needed for the nervous system. So if you have a stroke patient, they're going to be on a statin, but that statin's going to be wrestling against what you can get their body to do unless they're really precise in their diet and they start adding in, and it's up to you to get them to do it, add in healthy fats, tons and tons of healthy fats, especially if they're on a statin. Okay, now each lobe of the brain is fed by a different channel. So if you look at the frontal lobe of the brain, it's fed by the stomach and spleen channels. It's responsible for thinking, emotions. So what's this mean? It means, let's say somebody has a traumatic brain injury to the frontal lobe. Well, we know that the stomach and spleen channel now have to kick into overdrive to provide greater than negative 50 millivolts to the frontal lobe of the brain to attempt to heal it. So we're going to want to work on the stomach and spleen channel if it's a brain injury in the frontal lobe. Hopefully this is making sense. Okay. The occipital lobe for vision, like if somebody gets struck in the back of the head, the damage may be done in the front of the head. If somebody gets struck in the front of the head, the damage may be done in the back of the head. It's called contracoup. The bladder channel also feeds the corpus callosum. This is the merger of the right and left hemispheres of the brain. So you may have a patient like that, trouble with balance, trouble with left versus right, trouble with speaking, things like that, corpus callosum. Think urinary bladder channel. Temporal is liver and gallbladder, any auditory stroke issue. Parietal is all the fire channels. And then brain stem itself is liver. Okay, and here we can see a depiction of these lobes. And we can use scalp acupuncture to get the electricity close to the area of damage. Remember on our diagnosis, which acuchannel, which neural level, but which tissue is also a part of our diagnosis. So a patient comes in, they have paralysis in the right arm, and it says left parietal, damages in the left parietal lobe. Maybe it'll say on the report. Well, then you know you can place your needle over the left parietal lobe, and if you have a high enough voltage device, some of that electric should be able to get in there. Even if you have a lower voltage device, some of that electric should be able to get in there due to the quantum tunneling effect, where if you shoot an electron at a physical hard wall,
a certain percentage of them will pass right through the wall, and most of them will, and a lot of them will not pass through the wall. Anywhere on the parietal lobe. Yeah, you could go by tenderness, or you can go anywhere on the parietal lobe, and if you're using a higher voltage machine, the electricity will travel to the disease. Here's a side view. Now, Mary, your question is easier to answer on a patient by patient patient. Okay, let's say a patient comes in, they say parietal. Yeah, exactly. She's asking arm area, leg area. So the patient comes in, they show us that their scan shows that they have damage in the parietal lobe of the left brain, but they also have right arm paralysis and right leg paralysis. You'll notice that the motor arm and the motor leg areas are also in the parietal lobe areas, and that'll guide your needle. I'll give you this slide set, y'all. Okay, this is super important. Some of you already practice scalp, so you don't need to know this. But if you have not practiced a lot of scalp, the angling is super important. And I like the needle to slide in like butter. And I like to spin while I'm sliding it in. And it will go in easily on most people if you use a 10 to 15 degrees angling. Now, that is a very, very small angle, smaller than you would think. So, when you're first practicing this, look what 90 degrees is, look what 0 degrees is, look what 45 degrees is, and then try to cut that in half and then a little smidge more and try to get it at 10 to 15 degrees. A lot of times, if the needle is not going into the scalp as easy as we like it, that means the angle is too much. Does the pointer show you where to needle on the scalp? Yes, if you switch it to body mode and use the special attachment, you can get it to show scalp points. For me, I don't do that. Well, for me, I don't even needle scalp anymore, and I'll show you why soon. All right. This is why I personally do not use the scalp anymore. I am an ear guy. So you can pretty much practice scalp, but on the ear. You could pretty much practice spinal, but on the ear. You could pretty much practice auricular channels, but on the ear. And I personally love the ear. Yes, Ishan, I'm an ear nerd. So again, patient comes in, they show you their scan. They have right body paralysis, right arm, right leg. They have left on their scan. It says there's a damaged area in the left parietal lobe. Okay. All right. I take you can needle the scalp like I showed you, or you can take your Pointo Select over to the left ear parietal lobe area and use the Pointo to find the right point in the parietal lobe area. I like this better. It's more precise than the scalp. I like it better. And usually one of my 4 needles is this for a brain injury patient of any type. Usually 1, sometimes in the beginning 2 needles dedicated just to these different brain regions. Again, if they had a brain injury, chances are the immune system / toxins is involved. So there's one of my needles for the blood electric. If you have no clue what I'm talking about with blood electric, go back to the insider's course called The Quintessential Blood Electric. Now, Cynthia says only 1 ear at a time. Well, like usually the brain injury is only on 1 brain lobe. So I only needle that brain lobe, but my other 3 needles can go anywhere I want. They can go on the same ear, they can go on other ears, they can go on the body. And Brandon says, do you use opposite side? I use the same side as the tissue. So if the brain tissue is damaged on the left side, I use the left ear. If the brain tissue is damaged on the right side, I use the right ear. If the left arm is paralyzed from a right brain tissue injury, I use the right ear for that same side right brain tissue to treat the left arm. Does that make sense? Yes. And cranial nerves are the same side as well.
So what'd you think? Feel free to place your comments or questions below. Now remember, I created this great downloadable resource and the link will be in the description area, so be sure to grab that. I hope you enjoyed this episode, and if you did, click the like button. And if you have any colleagues that would benefit from this information, feel free to share the link with them. And for further information regarding my classes, you can visit www.electro-acupuncturemedicine.com. If you want more details on the Electro-Acupuncture Medicine Experience Mastermind program, click that link near this video. I'll see you next time.